So we are looking at the effect of translating the patient's head from side to side. Let's talk about this a little bit because this is a component of a lot of our other techniques. We're going to use translation of the patient's head to create locking below. We're going to use translation to bias the CV region. We even use translation to bias opening and closing in the mid-cervical spine. So let's talk about what this looks like and what the implications are of translating a patient's head. So if I got my hands underneath Vinny's skull and I take his head and translate to the left. First off, let's define what translation is. I'm not side bending him to the left. That would be different. I'm actually taking his head and translating him to the left. When I translate him to the left, his eyes remain parallel to his shoulders, right? If I were to side bend him, the line of his eyes would create an angle with his tops of his shoulders, right? So translation to the left, his eyes stay on the level. Looking at this, what happens? Well, in his upper cervical spine, I've side bent him to the right, as I translate him to the left. In his lower cervical spine, I've side bent him to the left a little bit, but kind of opened the right CT junction region, okay? The reason this is important is once I translate him this way, I have a lock below. When I try to move or PAVM, check the accessory glide of the mid-cervical spine, I can now take my right hand, bias him towards a little extension, and check that 45-degree angle, and nothing below my hand is going to move because I've translated him left and locked the spine below the area that I'm inducing the PAVM or the closing glide on the right at about C3-4 here in this example. By the same token, I could pull and check the opening glide in that position, inflection on the left side, all right? Lastly, what happens at the CV region? Well, when I translate the patient to the left, like we said, we side bend them to the right at the CV region. So right side bending at the CV region, especially C0, C1, creates left rotation. Left rotation would dictate posterior glide at the left AO joint, okay? So left translation, right side bending, couples left rotation, which means I've created a posterior glide at the left AO joint, which I can then test here this way, okay? So using translation for a couple of different things, I want you guys to understand that. Thank you for your time and dedication.